So, good morning, and thank you for joining me on this Saturday to talk about travelers and other diarrhea. I know it's not a interesting kind of title, but I think the content of this conversation will be of use for everyone here. I had hoped my husband could join as part of this conversation. I know many of you might have looked forward to hearing his humor on the topic. But he had to go to the hospital. He's got quite a few emergencies that he's taking care of right now. But please know that I reviewed the slides with him last night and he approves. So today I'd like to make sure we talk about what is the definition of diarrhea? What are some causes of diarrhea? But I'm not going to touch on diarrheal illness, which we in healthcare call inflammatory bowel disease, like ulcerative colitis or sprue or any of the long diarrheal illnesses that require a whole different set of approaches. How we evaluate acute diarrhea, what kind of, when you call me, what questions I'm asking you, why I ask you these questions, what you can do to help yourself during an episode, and some prevention and treatment options. So first, before we talk about what's abnormal in our GI tract, it's important to just understand what our GI tract is, what it does. The surface area of our intestines is approximately 1 football field. So that's quite a lot of organs packed into our abdominal area. And the function of the GI tract is to take the food we eat, come through the esophagus, digest it with the gastric acids and juices, take that food, break it all down, take it into our small intestines, which is all this area here, absorb all the nutrients and out of all the food we've just ingested, pack it down a little bit more, break it down. Bile is secreted to help kind of move it down. And then it goes into our colon. Now, our colon's job is to suck out all the water that now has been brought down and then and make it into the form of stool. And it also, our stool, what makes it brownish is all that food particle, but a lot of the bacteria that we normally consume. And it comes in part of in our food supply. And then it comes, our stools come out the rectum. This entire system is very vascular. That means it's got its own blood supply and it's spread out all over. It's highly innervated, but it's not like the nerve pain like from your spine, like if you have a pinched nerve. It's got its own pain fibers, which are in their stretch fibers. So the pain can be quite significant if you have gas, bloating, or cramps. It's kind of compared to pregnancy level pain. It's highly immune organ. It's the largest immune system in our body. So there's a lot of not lymph nodes. There are lymph nodes surrounding our abdomen, but actually there's embedded immune cells in here, immune globulins. There's lots of mucus glands, and our main function of the colon is to absorb water. So if we eat something that doesn't agree with us, our GI tract lets us know. If things are going in a little too quickly or coming out a little too quickly, it doesn't have the chance to absorb the water, and then we get the diarrhea. So to know kind of how that forms in our system is important. So what is diarrhea? I apologize. I heard something, so I'm just going to make sure we got everybody muted.
It's just Sharon. I'm getting on right now.
Okay, I'm going to mute you. It's sorry, it recorded you. Um, so acute versus chronic. No gastroenterologist wants to see any patient for an acute diarrhea. because those are usually self-limiting. But for us, it feels like, oh, it'll last forever. Most cases of what we call acute diarrhea, which is diarrhea 14 days or less in duration, are of an infectious etiology. In most cases, resolve with just symptomatic treatment. Symptomatic treatment means hydration. We'll talk more about it. Um, we think of diarrhea as loose or watery stools over at least three times in a 24-hour period. A couple times in a day is not that big a deal. It's reflected by that what I mentioned before, the water content of the stool. Whether it's because you didn't get to absorb it or you were just the GI tract was hyperactive and water was secreted. So it's really watery poop. The following definitions have been suggested, but it's not set in stone. So we think of an acute diarrhea as 14 days or less. Persistent is 14 to 30 days. And then if it lasts more than 30 days, we then consider it chronic, and then that requires gastroenterology attention. I'm going to talk about what's considered dysentery or invasive diarrhea, which is blood or mucus, in contrast to the loose stool. And when you have blood or mucus in your stool in an acute diarrhea, it's commonly accompanied by fever or abdominal pain. So, traveler's diarrhea is probably one of the most common causes of acute diarrhea. And that's when you get unformed stools during or within 10 days of returning from travel or at your destination. And I see it very commonly with our travel to Mexico and, whoops, sorry, and India. Um, It usually occurs because we've traveled to an area where sanitation and hygiene practices are limited and poor, or there's limited access to safe drinking water. Africa also. Most patients diagnose it themselves. It's again three or more unformed stools in a 24-hour period, and usually accompanied by some type of nausea, vomiting, cramps, or fever, or even blood in the stool. Symptoms are usually self-limited, lasts 1 to 3 days. In 15% of people, it can last over a week. In a very small percent, it can last approximately a month. This is one of the most common issues to travelers, affecting about 36% of people who have traveled to poorly resourced areas. Southeast Asia is also high in incidence, but it's usually when it's during their warm and wet seasons. And that's because you can buy food from street vendors or food that's been sitting out and then bacteria form. It also, other risks are when you travel to visit friends and relatives because you're not eating kind of Western food with them. Younger age people because they are more adventurous in their eating overseas, and people who are backpacking because they don't have that access to safe drinking water. Many of us are using what's called a proton pump inhibitor for our reflux. What happens with that is that it decreases your gastric acid juice production. Well, we need that gastric acid to kill whatever bacteria we ate that doesn't agree with us. So, using your PPI during travel, which we need because of the foods, as I've just described, these two countries have rich and spicy foods, also decreases our ability to kill the bacteria that we've just ingested from that country. So it increases our risk for traveler's diarrhea. Not saying don't take your PPI, just realize that that does make it harder for you to kill that bacteria yourself. So the names of the bacteria that cause traveler's diarrhea are many, all the E. coli's, and now we've got different types of E. coli: enterotoxigenic, enteroaggregative, pathogenic, and hemorrhagic E. coli. Campylobacter jejuni, which I'll talk about, found in dairy products, Salmonella, Shigella. C. difficile is not necessarily a traveler's diarrhea, but it is in the community. We ingest it, and if you've had recent antibiotics, you can um, select out the C. difficile. Vibrio, Eromonas. We'll talk about some of these others. One of the most common cruise ship foodborne illnesses is norovirus. And rotavirus is usually during seasons, adenovirus. We see diarrhea with COVID. And then these are some parasites, and these we start thinking about when people don't get better after their acute illness. So when we talk about, when you call me with the diarrhea complaint, I'm asking questions. And it's how long, when did it start? How much are you going? Is there fever? Is there abdominal pain? Is there blood? Are you dehydrated? Are you lightheaded, dizzy, palpitations? I ask where you've been. And when I ask that while somebody's complaining of diarrhea, every most folks are like, why is she going there? It doesn't matter. I'm sick right now, is the sense I get. But it helps me narrow down what we talked about here. So that's why I ask, where have you been? What did you eat? And then we talk about how to stay hydrated. And then I'm also talking about, how high is your fever? Is there severe abdominal pain? And then high risk host features. If you're over 70, it's considered high risk, or if there's other comorbidities such as cardiac disease. Are you on a diuretic? So there's so many other factors going in when we have that initial phone call conversation, but it's nice for you to see it written out. So you don't think I'm zigzagging around the conversation. It's so that I can decide, do we need to test you, or can we just rest and decide what to do? If there's any of these concerning suggestions or red flags, is what we call it, we then submit the stool for more testing. If you've had recent antibiotics, I'll do a C. diff. And then if there is fever or blood or something, then I might want to say, let's go ahead and start an antibiotic, and I'll show you that list. If there are no other symptoms, and it's not something that we have to report to public health, like if there was a diarrhea in a healthcare worker or a food handler, or thinking about, if you were just skinning animals out in the wild, then there's no indication for stool testing or antibiotic therapy, and we'd let it ride. And if there was any of these concerns, then we would get even molecular testing. So we don't always need to wait till something grows. Now we have higher, more sophisticated molecular tests that we can do for stool analysis. So in management, when I said, okay, what would we do? Fluid repletion, nutrition, and modifying the diet is our first step. The most critical therapy is rehydration by orally. Rest of the world uses oral rehydration solutions. We tend to go to IV right away, but it's important that whatever you are consuming has water, salt, and sugar. Diluted fruit juices and flavored soft drinks with crackers and broths may be enough if you have mild illness. Electrolyte concentrations of fluids for sweat replacement, like Gatorade, are not equivalent to oral rehydration solutions. And so that's important for us to keep in mind. Here is what is the composition of oral rehydration solutions according to the WHO. And Pedialyte is something we should all keep on hand because it is considered an oral rehydration solution. Amazon sells these oral rehydration packs for dehydration, and you can easily get those online as well and put them in your travel kit. I've put in something more recently called Liquid IV, And it's amazing when you're dehydrated. You can try to drink Gatorade and everything, and you're still feeling lightheaded. And I was hiking, and I learned this lesson, but I put in the liquid IV, and oh my gosh, your energy just picks up. Um, Apple juice, chicken broth, cola, Gatorade, ginger ale, and tea. Look at tea, zero in terms of rehydration. And I can't tell you how commonly I hear people saying, "Well, I've been drinking tea to help me stay hydrated or water." No, it's not going to make you feel better if you have diarrhea. If we choose to start an antibiotic, these are the more common ones. Cipro and levofloxacin, we've been trying to stay away from. Usually azithromycin for 3 days or 1 gram in a single dose. And this is what I've got in our travel instructions, should suffice for traveler's diarrhea. But if we have to, Cipro or Levo is fine. It's okay if you've got antibiotics on board, if we give you Lomotil to try to slow down the diarrhea. I would only do that if you're dehydrated and we have a good handle on kind of follow up and you're having more than 6 stools. Pepto-Bismol, believe it or not, that's why we put some of that in your kit as well, can also be used to slow down your diarrhea. But if you use a lot of Pepto-Bismol, there is aspirin in it, so be careful. We don't want you to get aspirin toxic. Now, let's switch. If you have any questions about traveler's diarrhea, go ahead and write it in the chat or save it for later because I'm now switching to medications that can cause diarrhea. Antibiotics, especially what I just said, erythromycin, Claritha, are common culprits to rev up our GI tract and cause a diarrhea as a side effect to that medicine. Nonsteroidals, believe it or not, can cause a diarrhea. Magnesium. Many people are using magnesium as laxatives, but you may start magnesium because it's the latest and greatest for sleep or leg cramps. And then you might say, I'm getting a diarrhea and not know that it's really attributed to that magnesium product you just started. Metformin is a common culprit. Same with a lot of the diabetes medicines. Cancer drugs are a very common culprit, so much so that Zofran is automatically given to anybody on cancer medicines. Proton pump inhibitors that I mentioned before, Nexium, Prilosec, pantoprazole, all of those, their side effects are a diarrhea. And then rarely, but it does happen, Lasix. And then there's also the weight loss. Some of the weight loss oral drugs cause a diarrhea. Here's a list of even more medicines that are known to cause diarrhea. Pretty much anything invented that we swallow can cause a diarrhea, but these are very common culprits that in more people than not. But statins are listed. Some of the diuretics, digoxin, we've seen our Parkinson's drugs. Even our anti-anxiety drugs like Xanax can cause a diarrhea. Our antidepressants, Prozac is a common culprit. Even thyroid medicine can cause diarrhea. Here's our NSAIDs listed. We know laxatives can cause diarrhea. Colchicine, which we use to treat for gout, one of the side effects is diarrhea. Antibiotics, like I mentioned, a big common culprit is amoxicillin, ampicillin. And actually, about 15, 18 years ago, whenever I prescribed antibiotics, 20 years ago, guaranteed, within 3 days, the phone would ring. I've got diarrhea or I've got nausea. Since I started recommending start probiotics when you start any antibiotics, those diarrheal symptom complaints within the first 3 days of antibiotic prescriptions have gone to nearly zero. It's important to keep in mind sugar substitutes are a source of diarrhea. So artificial sweeteners and alcohol. It disrupts the water absorption in our GI tract, and then we can get a diarrhea. And vitamins. Any vitamin nowadays can cause diarrhea just because they're now so thick and they have so many other substances with it. But like I said, magnesium. Now let's talk about food poisoning. That is a very common cause of diarrheal illness, usually very self-limited. I mentioned cruise ship norovirus is the most common, and I can tell you from personal experience that one of my uh, deployments when I was responding to a fire shelter. It just ripped through our entire shelter, and even my healthcare worker teams became ill. So not only am I managing norovirus for the shelter, but I've got IVs in my own teammates and had was taking care of them at the same time. So it can affect everybody in the home when you bring it home out from a trip. Salmonella is also a common bacteria that we see, and we'll talk more about some of these other bacteria. Staph aureus and Bacillus cereus probably are the most common. Staph or Bacillus cereus grows on food that has been sitting out, and you then eat it, and what happens is not only the bacteria grow, but they have a preformed toxin that then kind of sits there. Staph can grow on ham and pork and even pastries that have the cream in it. Bacillus cereus is in reheated rice because the toxin doesn't get killed. The bacteria does, but not the toxin. Certain sauces and soups. Staph is a gram-positive coccis. Um, it makes this toxin, and then usually your diarrhea happens within 1 to 6 hours of ingestion. I I think of Staph aureus usually in people if you've gone to a picnic. That's I think of that. Nausea, vomiting, abdominal cramps, fever, and it's self-limited. Usually lasts about 48 hours, and you're done. For Bacillus cereus, it's in the, now that you guys are seeing the Sharp app and seeing all the results, I've started to add a little bit more information in these presentations so that when you see some preliminary results, you understand why they're being reported. So Bacillus cereus is a gram-positive rod. It can cause two types of illness. It can just cause nausea and vomiting alone, or it can cause a diarrhea, or all of it. Reheated rice, sauces, and soups, Chinese food or Thai food, these are common sources. And it usually presents the day after, 6 to 18 hours after consumption. So sometimes we may not think it was that food. And it's self-limited, resolves within 24 to 48 hours. I can tell you in my home, married to a gastroenterologist, the no leftover rule is really painful. Listeria. I don't know if you've been watching the headlines, but this is just dated October 9th, 2 days ago. California company recalls over 240,000 pounds of pasta tied to listeria. Foods that are commonly linked to these listeria outbreaks include deli meats, cheeses. Boar's Head went through a huge listeria outbreak this summer due to their soft, ripened cheeses. Unpasteurized milk, raw milk is a big deal right now, and we're seeing listeria there. Smoked seafood, raw fruits and vegetables like pre-cut melons or packaged salads. They look pretty and convenient, but listeria toxins can grow on that. And then salad bars, sandwich bars also can have listeria, and the bacteria can grow even in the cold refrigerated temperatures. You can get really sick with listeria by eating the bacteria. If you're immune competent, that means you don't have any underlying immune deficiencies or diseases or are on immune suppressive agents. It usually lasts within 48 hours. We probably are ingesting a little listeria here and there, and our acids are taking care of it. But if you're pregnant or immune compromised, it can become a serious illness with meningitis. It can affect the heart. You can get septic, and the treatment is with IV antibiotics. Botulism. Um, we are seeing people just in the summer last month die in Italy due to contaminated foods with botulism. It's rare in the US. They had in Sardinia, folks had been 4 people died due to guacamole at a restaurant. It's you ingest a toxin from the Clostridium botulism bacteria that then you eat, and it blocks our acetylcholine receptors, which is used in nerve transmission. It's commonly found in canned vegetables. Home canned products are our biggest culprit here with improper temperature or canning techniques, fermented fish also. Botulism can infect wounds because the bacteria is ubiquitous. It's found in soil. Symptoms occur within 12 to 24 hours after ingestion, nausea, vomiting, abdominal pain, but we think botulism when we start seeing neurologic symptoms and a paralysis that starts kind of in our face, swallow trouble, and goes downward. All we can do is support the patient, and there is a botulism antitoxin. I know a lot of people get Botox. This is where it comes from. And so, right now, I just read a report yesterday of a botulism with nerve issues from a Botox party on the East Coast. So, don't do that. Get it from your dermatologist. Now, scombroid poisoning. I hadn't heard that term, but it's very common in the GI community. And that's a very common seafood associated disease throughout the world. Um, Fin fish, tuna, mahi mahi, you ingest it and it's got this preformed histamine that you swallow, and then it creates a big histamine reaction in your body. And it occurs because of improper refrigeration of that fish. And you get this pounding headache, heart racing, sweating, dizziness, a peppery taste, vomiting, diarrhea, and nausea. It happens very rapidly. You get a rash associated with it, and it's occurs, and this is a great picture because it occurs kind of while you're sitting there eating it. And while you're consuming this contaminated fish, many people may think they're having an allergic reaction to the fish, but it's a poisoning. And it usually resolves within 12 to 48 hours, and there's no long-term sequela. The next fish poisoning that can occur is the ingestion of ciguatera toxins. So fish eat this algae and which can, if there's like the red tide or something, then they eat a lot of this poison. And then the predator fishes eat that fish, and then you can get what's called ciguatera fish poisoning. And fish that eat the ciguatera toxin include barracuda, grouper, eel, amberjack, sea bass, and sturgeon. And it happens within 3 to 6 hours of eating the contaminated fish, but it can be delayed up to 30 hours. Um, there are seafood restaurants in town, and that's why I ask, where have you been within the last couple days to eat? Because I have seen patients have seafood associated diarrheal illness. Sometimes you can get With ciguatera fish poisoning, you can get numbness or tingling around your mouth. You can have itching without any rash, and you can actually get some atypical, what we call in medicine, dysesthesia. So cold perceived as hot or prickly sensations to your skin. I think I'm going to have scared everybody off of seafood by the end of this talk. Paralytic shellfish poisoning is a thing. And this happens if you're eating mollusks, mussels, clams, scallops, oysters, crabs, snails within hours of ingestion, because these are fish that will eat this poisoned algae and then carry this toxin that you then ingest within hours, and it's not killed by cooking. You can get that tingling that I described, but you can also get uh, ataxia. That means you feel dizzy and you can't walk correctly, difficulty swallowing, weakness. If you eat enough of it, paralysis, and it can lead to respiratory failure. So if we look at everything we just talked about and all the different types of sources, um, it's hard to, when you call me, to try to figure out what did what. But if there's vomiting more than diarrhea, we think about staph and pre-prepared foods, Bacillus cereus, or even a norovirus. If it's watery diarrhea more than vomiting, then we think of some toxins that you might have ingested. And if it's inflammatory with blood or mucus, then we think about Campylobacter, Salmonella, or Shigella, or even Vibrio. Now, here is a great schematic of all the sources of foods that can lead to food poisoning. Um, it's like pretty much everything: fruit, berries, juices, eggs, egg products, buffet meals, other foods, vegetables, all those mollusks I just described, bakery products. I really get scared, and I apologize. There are these grocery stores in our community that put food out in the sun in the hallways as you're walking up into their doors. And I look at that and go, this is just not good to be sweating in the sun, and toxins can form. I always get scared when I see sun hitting cheese products through the windows too, and deli meats. So this is why. Um, enough said there. So we talked about our Salmonella, Shigella, raw eggs, raw seafood, unpasteurized milk. Campylobacter is in soft cheeses, and that one we can treat with the Z-Pack. Homemade canned goods, I mentioned. Raw hot dogs. I don't know that many people who eat raw hot dogs, but we have to be careful of that for listeria. And these lists are just partial, as you can tell. We can just keep going on and on. Here are some other acute diarrheal illnesses that can occur. Hepatitis A, we forget about. And we talked about botulism. Vibrio vulnificans. It is a rampant, when it happens, it rips through the body, raw shellfish. Many diabetics should not eat raw shellfish because their immune system can't handle Vibrio. Typhoid, that's when you're traveling to an area that has poor sanitation. You get fever with diarrhea. Brucella, that's why I have Mr. Cow here. Animal workers, especially with who work in the meatpacking industry or are working with cows, veterinarians have to, are they're actually get a vaccine against brucella, but we do see brucellosis in them. And then toxoplasma, we forget about that. But if you own a cat Cat feces can carry toxoplasma. Oh, sorry about the typo. Gondia. Um, Pregnant women have to be very careful. And my instructions to pregnant women are do not change the kitty litter. Now, once we've gotten through the acute diarrhea, what happens at day 30? And I know I said I wasn't going to talk about kind of chronic diarrhea, but what a lot of people have described is that they've gotten a vaccine or gotten COVID or gotten an illness or they went out to eat and their GI tract has never been the same since. And it can be 30, 60 days, 90 days later. And what we then do is we send them to the gastroenterologist to look for something called microscopic colitis. And that's because something got changed in your GI tract due to that inflammatory process and created kind of an allergic reaction or an inflammatory reaction. There's two forms of this microscopic colitis called lymphocytic colitis and collagenous colitis. It is treatable. So it's not like you got a new like ulcerative colitis or other colitis disease. So the word colitis can get scary when I use it. So that's why I wanted to kind of educate a little bit more here. It occurs, collagenous colitis, about 10 people per 100,000 per year. It is something I see a little bit more frequently because median age is about 65 years, higher incidence in women. Women are about anywhere from 50 to 80% of the cases. Lymphocytic occurs a little bit more frequently and in Northern European and northern parts of North America. Autoimmune thyroiditis, if you have type 1 diabetes, if you have an arthritis history, if you've got some celiac or Sjogren's in your profile, then some of these other triggers for diarrhea can then turn on a microscopic colitis in you. Um, Here are some other drugs that can turn on a microscopic colitis. Um, Acarbose, which is an artificial sweetener, aspirin, some sleeping meds, some flavonoids or supplements, proton pump inhibitors are antidepressants. Sorry about that. My computer's gotten too sensitive now. Tegretol, Celebrex. These are intermediate likelihoods, and then low likelihood is Tagamet. I definitely have had a patient say they can't tolerate any of these, but they can tolerate Tagamet. How does it happen? Well, it's unclear. It's thought to be multifactorial. That means that you might have had some genetic predisposition. There's then an abnormal collagen that kind of deposits in the lining of our cells, and then the barrier then to absorb water gets disrupted, and then you get a diarrhea. They think it's because of that inflammation that can occur, or that you're not absorbing your bile, and then things kind of move out fast. It's not a dangerous diarrhea, it's just inconvenient. The only way to really diagnose it, stool studies are normal. So I'll send you to the lab and everything's normal, and you guys are like, oh, why is this still happening? Biopsies are the main way for us to prove that this is happening, so then we can treat you. We definitely have to make sure there's none of the prior bacteria and viruses that I've spent the last 30 minutes describing. We do that to make sure nothing's infectious. Sometimes we have to do 3 samples for ova and parasites, especially if you've traveled or been hiking and then 30, 60 days later you still have diarrhea. And we want to make sure that we rule out anything before giving you a diagnosis and getting biopsies. Now, this may be a little bit of too much information, But I've seen you all come back with your colonoscopy reports and then the reports of the pathology. So I thought it would be important to include here that you can get a lymphocyte predominant or collagenous predominant. And this is kind of how the report will look, or it will be incomplete. But they will give you this terminology in your report and describe kind of the location in the lamina propria of your lining in the biopsies. And this will help it make sense for you. So, when a person has had diarrhea over 30 days, all the general measures that I described previously, and hydration and checking all the medicines. If you're smoking, which none of you are, that smoking can be a trigger for colitis. That should stop. It's okay to give antidiarrheal medicines once all those tests are negative. But once the biopsy is proven, steroids are given. And it's usually ingested steroids that then just stay in the GI tract. And it requires at least 4 weeks of therapy, or maybe even 12 weeks. Prednisone orally is only for those who have severe disease, and the oral budesonide is not feasible. These patients are followed by GI. And then there's even more layers if this initial response fails. So I just wanted to kind of give you the first step. I think this slide is very important, and I put it at the end so that when you have any diarrheal illness, there are some modifications that you should make because we forget to think about that. Avoid dairy products while you're having diarrhea. And that's because of what I mentioned before. You've got inflammation, your GI tract is not feeling good, and then you put in dairy that we know can have trouble digesting lactose while you're sick. And then you make it aggravates your gas and your bloating symptoms. And then you may actually trigger a future lactose intolerance if you challenge your system while it's not feeling well with dairy. Avoid raw foods. Your intestines are already unhappy. That's a direct quote from my husband. And then you're now putting in raw fruits and vegetables that your GI tract has to work extra hard to digest. Keep oral rehydration solutions on hand, not Gatorade. Gatorade is a sweat replacement, not a GI replacement. Have lots of soups. That will help. It's already pretty much pretty cooked and broken down, so the nutrients will get absorbed. They will have salt in it, have some carbs in it. So lots of soups, and it will help. The salt part will help the fluids get absorbed in your system. I recommend when you're feeling good. Whoops, sorry about that. When you're feeling good, make extra batches of soup and put it in your freezer so that when you're feeling bad, you don't have to rush to the store and heaven forbid you order soup from a store that then could make you even get worse. Probiotics, I strongly recommend we keep some in your refrigerator at all times so that if you do develop a respiratory infection or a sinus infection or a UTI or a reason that I need to give you antibiotics, you automatically start your probiotics with it. Usually, don't take the antibiotic and probiotic together. Take the antibiotic with food before your meal or at the start of a meal. And then once you're finished, then complete it with the probiotics. So basically, you are repopulating your GI tract with healthy bacteria that your antibiotic just killed going down the system. And I hope that provides you some common sense to your digestive tract. Listen to your body, and I hope I've given you some signals to listen to your system when it's off. With that, I thank you very much for your time, and I will now stop the recording so that we can do